Thanks, Andrew. I started to get a bit worried that maybe I needed to change all my slides. Just let me apologise first. I have a bit of a post-viral cough at the moment. I also have a vision impairment, so this kind of darkness is freaking me out just a little bit. And what that means is that I will tend to look down at my paper or turn around to see what's on the big screen. But rest assured, these are my slides, and I have actually written them and know at least some of the material. I would also like to acknowledge the fact that we're meeting today on the land of the Wurundjeri people as the first custodians of the land in which we're meeting, pay my respects to elders past and present, and also to extend that respect to any Aboriginal and Torres Strait Islander and First Nation people who are present and with us today. So what I plan to talk about is to give you a bit of a sense of the Prevention Tracker initiative, the structure of Prevention Tracker, and some of the fundamental assumptions that Prevention Tracker is based on as the kind of first port of call. I also then want to go on and give you a bit of a sense of what it actually looks like in practice in local communities. To talk about what approach we've taken in terms of systems thinking or the application of systems science and some of the challenges and opportunities that's presented for us. Doubtless that there are some team members in the audience, but I can't see you, I'm afraid, who are probably wondering how we could possibly fit the challenges only onto one slide. But maybe that'll be a part of the discussion. So Prevention Tracker is a national initiative, and by that we mean that it's operating in 4 communities across Australia. So it's happening in Albany in Western Australia, Broken Hill in New South Wales, Glenorchy in Tasmania, and the Gold Coast in Queensland. So we do spend a lot of time doing work at airports, which has posed its own set of challenges. The structure of Prevention Tracker is that we have a key local partner organisation in each of the local communities, and we have a memorandum of understanding with the partner organisation, which I understand is quite a traditional instrument, but provides, I guess, the mechanism for us to have those initial discussions. We also have a local advisory group, and that's an opportunity to extend the involvement of a range of other players, organisations and people from within the local community who have an opportunity to guide and adapt Prevention Tracker in the community context, and I'll talk about that in a moment. But more than just working with partner organisations and other key stakeholders in the communities, we've also drawn on an extended network of researchers from across TAPS. And TAPS itself has created a fantastic infrastructure for us to be able to draw in skills in issues of aspects of system science methods such as social network analysis, but also in the expertise of the application of systemic inquiry processes. And that's certainly been very critical for Prevention Tracker to have gotten as far as it has. As you see, we're due for completion in June next year, so we're not as far advanced as the work undertaken by Sharon and Paul. So we've certainly still got a bit of a ways to go. The broad framework for Prevention Tracker is that it aims to describe, guide and monitor system change efforts within communities. And there are many assumptions upon which Prevention Tracker is based, but there are 2 that I think are really important for the discussion that we're having this afternoon. And the first is groundbreaking as this might sound, but prevention systems already exist in local communities. So there are already people and organisations, as Andrew spoke about. There are people, organisations, networks, programs, a history of effort, of beliefs and norms and values, and all of which are working to improve the health of local communities. So the first assumption that Prevention Tracker is based on is that initially we need to describe, work with our local partners and advisory groups to describe and perhaps better understand and gain new insights into how the prevention system operates within local communities as our starting point. The assumption being in that in understanding and gaining new insights into those contexts, we'll be better able to create opportunities for effective change within that system. So that's the first assumption. The second assumption is that systemic inquiry processes will lead to systems change. And here I can paraphrase the work of Penny Foster-Fishman and Erin Watson in the US, who say that change efforts quite often focus on the surface aspects of local problems and rarely focus in on the underlying systemic conditions that bring rise to these local problems within local communities. And that's what we're aiming in Prevention Tracker. And there are two aspects of that I'll just pull apart just briefly. The first is systemic, and by systemic we mean relational and connected and holistic. So the focus of our insights in describing the nature of the prevention system and guiding change efforts is to constantly focus on the systemic aspects of what might be going on, the interconnections and the relationships between things, rather than any one component of the prevention system, the kind of work that Sharon talked about initially in the first presentation, sorry. So we need to focus in on that, kind of constantly refocus our attention and make sure we're focusing on the systemic aspects of the system. And the second is inquiry. And as researchers, this is what we're in the business of. We engage modes of scientific reasoning that direct our methodological efforts and present to us findings that unfortunately we quite often hand to others to implement, people like you, Paul. And then we step out. In Prevention Tracker, we're opening up the opportunity to engage in that inquiry process to local stakeholders and partners. So within Prevention Tracker, that inquiry in terms of guiding decisions made in terms of methodological adaptation, to interpret and reinterpret data, to work with local community stakeholders in the creation of models in the context in which they can be acted upon. And so that second assumption is that engaging in those kind of systemic inquiry processes, drawing the people who will act on the knowledge into its own creation, maintaining that systemic focus will bring about systems change. And of course, that's ultimately up to what we're hoping to achieve. That didn't move. Whoop. No, I need to go back. Sorry. Aha. So what does this mean in practice? So the first aspect of Prevention Tracker, or the first phase, is to describe the local prevention system. And we've applied a range of different methods in the communities and we're at various points in time with the work with the communities to describe aspects of the prevention system. And I've presented just a few here. So we work with the local advisory group to bring together an infographic of the nature of the community in terms of its people and its health, to map livability indicators for the environmental conditions that may affect people's choices, such as access to fresh and healthy food, or distance from liquor outlets, or the distribution of the population that doesn't have an access to a car, which in many of the regional communities is a key factor in whether or not they can access fresh and healthy food, for example. We collected data on the nature of the prevention workforce, which is the human capital of prevention, the skills, the capabilities that are at the community's disposal in terms of implementing prevention efforts, but also the organisations involved in prevention who are active. How are they connected? How do they share information, resources, joint plan and engage in joint funding? And there are many other aspects of that data collection in describing the prevention system. But of course, what we didn't want to do was create all these insights from the outside, even though our advisory group assisted us in the adaptation of those methods. And what you see in the middle here is a community map that we commissioned a graphic artist to pull together various aspects of this data into one community map, and in this case, it's of Glenorchy in Tasmania. We used this as a device to engage in data synthesis workshops with the local community. So these were members of our advisory group and then expanded out into other people and organisations within the prevention system. And that provided a unique opportunity to be able to invite people to interrogate the nature of the data, to discuss and describe why things are the way they are, to layer on new information that might be more temporally relevant into the community at that point in time. The stakeholders involved in those workshops were also invited to look for patterns in the data to help describe why things might be looking the way they are. The outcome of this process was the identification of a key local problem that would then form the basis of the next process of inquiry within Prevention Tracker. And what we found really exciting and interesting within the Prevention Tracker team is that in both cases where we've undertaken this with 2 communities so far, the local problem that was seen as critical to strengthening the local prevention system was, in one case, how to better engage a diverse set of voices and organisations in prevention, so how to make sure that there are multiple voices in any decisions, but also how to reach across traditional prevention boundaries in undertaking prevention efforts. And in another another community, it was about how to strengthen and improve collaborative practices and the skills and the commitment and value of collaborative practice as one way to reach across traditional silos. So in both instances, even though these maps spent a considerable amount of time talking about aspects of risk factors, chronic disease, and how it might be distributed across the community, the communities and the range of stakeholders actually looked through those health problems to some of the systemic conditions that they thought were critical in why things continue to be the way they are in those communities. The next process, and I should say the next part of this process, is that in one of the communities we've already used that locally identified problem to undertake some group model building, and at the moment they're creating causal loop diagrams on that key local problem, and we've undertaken a number of those kind of workshops. So that's certainly the next stage, or the next phase. So what is the nature of our systems approach? It is about the application of systemic inquiry processes and methods. And here I'm just pulling out a couple of the key conceptual guides that we've used to assist us in thinking about how do we create a coherence in this work. The first is to focus on the systemic nature of what might be going on and that description, and I've spoken about that. Also about understanding the situations or problems in context and making sure that the context is the reference point that we constantly come back to with our local advisory group and community stakeholders, but also within our team, and use that as our reference point in creating new and additional insights. And we've undertaken a range of different approaches to be able to achieve that so far. We also want to create a learning environment, which is a key aspect often banged on about by the soft systems methodologists, but also others within systems thinking. We need to facilitate that learning, because if the learning is only from outsiders into communities, then change will be very slow indeed. But also, we're unlikely to be able to identify those key local factors that only local players and people can bring to the table. That social learning, sense-making together, does provide the opportunity for shared understanding, and so far that is what we've observed within Prevention Tracker. Other aspects of our systems approach is the recognition that we need to engage with multiple perspectives. The prevention system is made up of people and players and beliefs from very different vantage points across the system. And so we need to be able to engage with those multiple perspectives. We're constantly asking who now needs to be involved in the discussion as we create as we identify with the community new local problems or other issues to be addressed. Now who should be in on the conversation and a part of that process. And a part of that is the co-creation, and it's about creating for us, it's about creating knowledge or new knowledge and new insights, which is what the communities were after, and our partner organisations said that they wanted new insights. So how do we create, and making sure that we're facilitating the opportunity to create new knowledge in the context in which that knowledge can turn into action, which is a key aspect of the work that we've been doing. And I think the group processes of identifying a key local problem we could not have predicted is a good demonstration of that. So why the systems approach? I think it privileges focusing in on systemic insights rather than the particulars of any one program or risk factor, for example. And we ourselves as researchers have to constantly make sure that we're paying due attention to the system level, the structure of how things might be operating. The nice thing is that it brings together process and method. As researchers, we can be very methodologically driven, but that needs to be embedded in a process that reinforces the new insights that are gained through these methods. And I'd probably, with hindsight, add process, method and context to them. It is also about learning by doing, and I can't remember where this quote comes from, so you can shoot me down on this one, but the notion that we can act our way into new ways of thinking is something we've certainly observed within Prevention Tracker in the work that we've done, and I think that is a key notion that we constantly come back to. And it's most likely to lead to sustainable change, and I've added a question mark there because sustainability is a future event, but we're hoping that we're creating the conditions for that to happen. Some of the challenges, and this is the last slide, Andrew, is that the starting point is uncertainty and complexity, and that yikes comes from me, I think, nearly every morning, because that uncertainty means as researchers we've had to create adaptive methods and tools and be willing to change direction, and that can certainly be very confronting. Systemic inquiry, at the moment, the terms of the methods and the processes is quite specialised, and I think we need to kind of pay attention to what that means. But hopefully it also provides an opportunity to surface a lot of innovation that can happen in communities who are at the coalface of chronic disease prevention. And this is a range of people involved. Thank you.